Thank you so much, Kristen. I'm so excited to be here today. So I'm very grateful to speak with you all today about the topic of journey and aging with Hunter syndrome. For those who don't know me, I am a medical student and business student at Harvard Medical School, Harvard Business School, currently a researcher in the Bridges Adult Transition Program at Boston Children's Hospital, and a former board member of Project Alive. And I feel very grateful and honored to be able to give this talk today because it's one that's very personal to me, but also it's because this talk has been made possible because of the generous support from Project Alive and its incredible team and board members. So I'm excited to share some very wonderful and insightful updates from our current research study that we've been doing together and some new data today in today's talk. So I understand that a lot of people here today are in different stages of their journey with Hunter syndrome and aging with Hunter syndrome. And so with that said, I hope that today's talk will be able to provide insights no matter what stage of the journey you all are in today. And I know it can be quite scary to think about the future of Hunter syndrome and all the uncertainties that come with it. But I hope that through the talks, through the stories, and through the data that we're going to go through today, it can provide some insights and some hope, no matter where you are exactly in this journey. And so our objectives are to explore the experiences of people with Hunter syndrome and their families with age. I also hope to identify some of the support needs and resource gaps that patients and families have identified with aging, specifically during the transition from pediatric to adult healthcare. And lastly, I hope to provide strategies that you all can take away today to help with your journeys of Hunter syndrome, whether that be through aging into adulthood, managing challenging symptoms through childhood and adulthood, finding respite, and long-term care planning. And so for those who don't know, this here is my twin brother, Nick. He has the severe form of Hunter syndrome. He was diagnosed when we were 3 years old, and now he is, incredible to say, 28 years old, almost 28 years old here in a few months. And he has been my biggest inspiration for all that I do and for this talk here today. And it's quite an incredible thing to be able to say that it is true that people with Hunter syndrome are aging and living longer. When my brother was diagnosed back in 2000, we were told that he would only live up until the age of 10. And now being 28 years old is just quite an incredible feat and something that my family never expected. But it's not just my brother. There's many other people all over the country, all over the world living into their adulthoods. And it's because of the incredible research and advocacy that organizations like Project Alive have been doing that have helped families get here today. But the thing is, while people are living longer, there are some challenges that come with being an adult. One of the biggest challenges that research and advocacy, while it's been incredible, it's largely focused a lot on newborn and pediatric ages, causing a lot of adults to face challenges that haven't really been adequately discussed and supported. And so because of this, as people with MPS age, they may unfortunately lose access to really important, needed medical, educational, residential, caregiving, and community supports. And so while there is a lot to do when someone is diagnosed and newly diagnosed with MPS, it's also important to start thinking about aging and what the future will look like with MPS as well. And so even though it can be scary to think about the future, starting to think about the future early can make the future better to manage. And so there's a saying that we say in the disability advocacy community, the future is now. It's important to start thinking about it and planning so that we can have the supports that are necessary into adulthood. And so with MPS, Hunter syndrome specifically, one of the biggest challenges that have been identified through these family conferences is the challenge of transitioning from pediatric to adult healthcare. And so there's very little currently known about the transition process when people with MPS age out of pediatric-centered hospital care and move into adult-centered care. And a lot of this is because most of the providers caring for people with MPS tend to be pediatric providers housed in pediatric medical settings. A lot of the adult healthcare providers don't have the knowledge or experience yet to take care of people with MPS, but as they are aging, adult providers are needed even more. And so one of the biggest challenges is how do we help people with MPS and Hunter syndrome transition safely and effectively from pediatric-centered to adult-centered medical care? And currently, since such little is known and there are so few resources to help with this transition, a lot of the transitioning process relies on the help of caregivers, family caregivers, parents, and siblings to do the coordinating, to do the advocacy, to make sure all of the resources are in place when people with MPS age from pediatric to adult-centered care. And with all the things that caregivers are doing, not just medical care, but just helping with daily living activities, a lot of these caregivers can feel overwhelmed. Going back to the talk we had just earlier about decision fatigue, making all these decisions can be so overwhelming that caregivers themselves can feel just totally burned out and have worse health, mental health, and physical health outcomes themselves. So it's really crucial for us to recognize what are the experiences of people with MPS and Hunter syndrome as they age from pediatric to adult-centered care, and how can we help facilitate a smooth, effective, and safe transition? And so to help with this, with generous support from Project Alive, we put together a study to describe and identify the experiences and support needs of patients and families during the aging process, particularly looking at the transitioning stage of moving from pediatric to adult-centered medical care. And so over the past several months, we've put together this survey that was an electronic-based survey that people can fill out online, which I'll talk a little bit more about, to capture what are the experiences and support needs. I'm so grateful to be able to work with an incredible team of experts around the country to put together this study. Our team members consist of people on Project Alive's board, as well as members from Boston Children's Hospital, Harvard Medical School, here at UNC in the Munzer MPS Center, as well as at the University of Minnesota at the MPS clinic there. And so to identify the support needs, we developed this online survey that integrated both quantitative checklist of different questions, as well as qualitative, open-ended questionnaires that ask patients and families about their experiences with aging and transitioning care. We surveyed both parents, siblings, guardians, really any family caregiver involved in the experiences. And a lot of the survey was specifically guided based on focus groups we did with many of you here at Project Alive's conferences in the past. Our survey is currently still open and will be closing though here shortly on Monday. Here is a link to the survey and I'll have this link here at the end. But we're still actively looking for people to participate in the survey. So if you're at all interested, please feel free to take a picture of the QR code here. It should hopefully work. If not, I can give you a direct link. But we are looking to get experiences, as I mentioned, from anyone at all during this process of living with MPS, both those who have fully transitioned to adult care, as well as those who are thinking about the process of transitioning, or even those who are newly diagnosed and just curious about what the transition process might look like. We want to hear from all of you, no matter what stage you are in. And so in the next few slides, I want to highlight some of the data we have captured so far since our survey has been open for the past several months. And so this here is just preliminary data. And so far, we have surveyed 23 participants who have MPS in the United States. 9 of them specifically are patients, individuals diagnosed with the condition, and 14 are caregivers. Individuals in the study have a range of MPS conditions, which was wonderful to be able to hear from a diverse group of people. But most of them had either MPS 1 or MPS 2, with about 26% of participants so far having MPS 2. And the ages ranged for patients was between 19 to 31, with the average age around 25. And so far in our study, 11 participants fully transferred to adult-centered medical care. 3 of them did not transfer. And a lot of the reasonings for those 3 who did not transfer to adult care, so they are adult age but still receiving care in a pediatric hospital, the reason for that is varied. A lot of it is just because of personal preference. A lot of it is institutional policy based, And some of it is just based on the disease severity and wanting to keep all the medical providers in one setting. But as you can imagine, keeping an adult in a pediatric hospital required a lot of advocacy and navigation with medical and legal providers for a lot of these 3 participants. And then for those who did transfer to adult care, the average age was 18. And here is the fun data. So when we look to see what exactly did parents, caregivers, and patients say about their experiences with transferring to adult care, a lot of them identified several specific challenges that highlights different needs that we need to address to better support patients and families during the transition process. So when we asked them what exactly were their challenges that they faced during the transition process, interestingly, you can see here in the red box, sorry, I didn't go all the way to the bottom, but I wanted to highlight 3 of the specific findings from the study, and 3 of them were that caregivers, parents, providers, they all found that they have a significant challenge finding adult providers who are knowledgeable and willing to take care of people with MPS. And that there is not surprising, right? We knew that a lot of adult providers don't have the necessary training, but just the fact that the majority, over 80% of our participants said that they just could not find an adult provider willing and trained to take care of their kids with MPS just shows that we have a lot to do to do better training, better resources, better support for adult providers in the community. The other big issue was that a lot of the adult providers were uncertain about how to coordinate with the other specialist. And so one of the biggest challenges is that all the providers in the medical field often transition care separately based on what specialty they're in. So oftentimes a neurologist, for example, might transition care at the age of 18, but an orthopedic surgeon might transition care later at the age of 25. A geneticist might never transition care. So the biggest challenge is a lot of times MPS patients might have providers who are at the pediatric hospital like the geneticist, but then have a neurologist, an orthopedic surgeon, other specialists who are adult providers at an adult hospital. And the big challenge is how do we coordinate all those different specialties together? And a lot of that coordination, according to the patients and families in our study, showed that a lot of that coordination all relied on the family members to do themselves. So a lot of the families said that we need better help coordinating all the different specialties within a multidisciplinary care setting. This here was one of my favorite findings here that was really telling. And we asked caregivers who did transfer care from pediatric adult center care, what was their perceptions and overall experiences? And only 40% of the caregivers in the study felt that the adult providers were knowledgeable and understanding of what their experiences were like with MPS. Also, only 40% felt supported by the medical system during the transfer to adult care. And then 50% specifically said that medical services were completely lost during the transfer to adult care. And likewise, only 50% said they were glad that this transfer happened. So again, this was just preliminary data. We're getting more study results coming in as we speak. So a lot of this might change, but this is pretty telling that a majority of people felt unsupported and wish the transition did not happen at all and lost important services. When we asked how did the transfer of care specifically impact the health of caregivers, we found that the majority of caregivers, over 83%, experienced increased anxiety, worry, and stress during the specific transition of care process. So this here, they may have already had some level of baseline anxiety and stress, but during the transition, this increased. Also, we found that many caregivers had increased pain symptoms, including headaches, abdominal pain, muscle pain, and other feelings of general bodily pain that increased during the transfer of care process. So this just shows that, as I mentioned, the caregiver is doing a lot of the coordination, a lot of the decision fatigue that we've talked about. All of that can affect the overall health and well-being of caregivers themselves. And if caregivers aren't doing well, they aren't able to as well provide care for the patients with MPS, which can affect their well-being too. So it's really important that we try to identify ways to address this gap. When asked specifically people with MPS what their experiences were during the transition, some interesting highlights here is that one individual said that they're having spinal surgery in a few weeks, and their medical team still did not decide if the procedure would occur at the pediatric center or the adult center because the adult center didn't have the equipment available for their body size. So oftentimes, adults with MPS, chronologically, they are an adult in age, but physically they may still be the size of a pediatric patient. And a lot of the adult centers don't have the pediatric sized equipment needed to help with anesthesia, other surgical procedures for adults with MPS. So this causes a lot of uncertainty about where procedures are going to even occur. This is like such a huge issue, and that's something we haven't really talked enough about. So it's really important to start thinking about how do we get the medical equipment, the financial resources in adult centers to care for people with MPS who might be pediatric sized. When looking specifically at caregivers, we found that a lot of caregivers said that we are in the process of trying to find adult providers, but really struggling, as mentioned from some of the other data that we presented. So overall, families have experienced significant challenges finding adult providers with appropriate knowledge, skills, and equipment needed to care for patients with MPS. And because of this, many lost services as they aged. So these studies really highlight that we need to do a lot more advocacy in pediatric and adult centers to make sure that providers are trained, to make sure that there's coordination support, and to make sure that they have the equipment, medical tools necessary to help during the aging process. Also, these results show that it's really important to have providers who are willing to help families during the aging process, no matter what stage of life they are in. A lot of providers and patients said that it was helpful when the discussion about aging happened way before it was needed to start the transition. A lot of patients said that it was helpful to start thinking about future planning when they were in their early teens. So starting to have these conversations early is really important, and something that can be really helpful when talking with providers about is like, hey, at your next appointment, just talking to the provider and saying, we're thinking about these challenges as we age. Can we start thinking about the process of transitioning now early so that we're not in a struggle when it comes time when they're 18 and need to transfer to adult care? And so we still have, as I mentioned, still collecting data, and our survey will be closing shortly here on Monday. But if you are at all interested in taking the survey, please feel free to take the survey link here at the top. You can click on the QR code, or there's a link at the top, or feel free to come find me anytime today, and I can help you find the survey. And again, we're looking to get experiences from everyone, even if you haven't fully transferred to adult care. And just briefly, I know that I think we're running short on time, but I know a lot of other questions that came up on this talk too is not just the transition of care process, but what about the overall experience of just aging with MPS? And I wanted to highlight just some brief findings from another study we did with many of the same experts that I showed earlier in the screen. This was a study that looked at people who have the severe form of Hunter syndrome, who are adults, and looked at their support needs. And we found that one of the biggest challenges for those with the severe form of MPS2 was behaviors. And a lot of this was talked about earlier in Leanne's talk. But one of the biggest things with adulthood is how do adult issues, specifically adult health issues, affect behavioral challenges? And a lot of people in this study verbalized things like they're concerned that maybe migraines, headaches, gallstones could contribute to behavioral challenges in individuals with MPS2. And so this is something that we really need to think about when we see an adult with MPS2 and they might have a behavioral challenge and are unable to verbalize why exactly this behavior is occurring. We need to really think about not just typical hyperactivity, sleep issues, but also other adult problems that can happen in individuals with MPS, like migraines, headaches, GI problems. It's really important to do a full workup to identify those things, as mentioned in Leanne's talk. Another big thing that we found in this study was a lot of patients, family members found that augmentative and alternative communication devices were really helpful for individuals with MPS, the severe form especially, when it came terms to behavioral communication. And then the other big key thing here is environmental modifications. A lot of families found that it's really helpful to have equipment in the home, safety equipment, safe rooms, safety beds, as mentioned, modified doors, one family found that having a sensory gym that they put in one of their rooms was so helpful for some of the behavioral challenges and sensory overload that a lot of people with MPS, especially into adulthood, might experience. So a lot of these things can be really helpful for adults as well. And then lastly, the biggest thing I really wanted to share today is a lot of families have found that when it comes to aging, it's incredibly important to have respite and residential support services. So this can look very different for families, especially also can look very different based on the state you're in. But a lot of families have found that having a respite provider come to the home, if that's an option, or having a short-term or long-term respite provider outside of the home was so helpful for some of the challenges that come with aging and living with MPS. For me and my family personally, we found it's really helpful to have support from an outside provider to help my brother with some of his respite care. He currently lives in my home, our home, half of the time, and then the other half of the time, he's at a long-term care facility that has both medical and behavioral support staff, which has been so incredibly helpful for him to be able to not just get the medical and behavioral support he needs, but also to be able to live somewhere that's not just our family home, to be able to be around other people like him and to have activities in the day with staff who are able to do that with him safely and in a healthy way. So this can be its own talk in itself, but I just want to hear mention that these respite providers, residential services are so important and something that I really hope we talk about more during conferences is how crucial and important these services can be for families. And lastly, Project Alive has this incredible resource you can find on their website to help specifically with the aging process. Again, you don't have to be an adult to access all these resources. Even just thinking about aging in itself, you can come to these resources here listed on the webpage and can find support no matter where you are in the journey. And so with that, I think we may be short on time. Sorry for going a little over, but feel free to ask any questions. I'm happy to talk about this afterwards, but overall, there's so many things to think about with aging, and just hope you take away today that it's never too early to start thinking about it. Thank you.
Nathan, question, there are certain areas of the country, right here is one, where they specialize in care for children with MPS. Is it the same kind of areas for care for adults? Or like, are there particular places where there are more specialists who are familiar with that? Or is it not, is there nowhere that kind of specializes in that? If that came out in your research at all?
Yeah, it's a really great question about specialists in care knowledgeable at MPS. So it is location specific, and that's one of the biggest challenges. So here at UNC, we have the incredible support from Dr. Munzer, who's so knowledgeable in MPS, and with his training, not just location specific, but also training specific. He's trained as a geneticist, and they're able to take care of both kids and adults based on their board certification. So that's why here it's really wonderful that people with MPS can get care and don't always have to worry about the transition process because people like Dr. Munzer can still take care of them into adulthood. So we did find some of those specific location and provider training specific differences in the data set. So as I mentioned, we had people who had geneticists, neurologists, surgeons, all those different experiences. The geneticist, we found that there really was not much of an issue because they could still take care of them into adulthood. But then when you think about neurologists, surgeons, all those people, the way that they are board certified is either in pediatrics or adulthood, unless they did dual residency, which is very, very rare. So what it's important to do is when you go to a provider, kind of understanding what exactly are they certified in? Are they certified in kids or adults? And that's kind of what's going to tell you if they're going to have that pressure to transfer to adult care when you get older. And this is the other big issue. The age of transfer varies based on what hospital you're in. So a lot of hospitals might transfer you at 18, a lot might transfer 21, others might just have different ages, even based on the clinic themselves. So that's one of the things is when you're diagnosed early into childhood, a lot of times early teens, a lot of families start just asking providers, what are your policies around transitioning? can we start early? A lot of families found it in our study. It was helpful to start early around 13 to think about this. And then thinking about, geneticists might keep you, but all the other providers might not. How can we keep the geneticist in touch with the other providers so that there is that multidisciplinary communication?
Yes, looking back, how did you feel when you really introduced this actual clinical care and understanding of that? And do you wish it had been at a different time? Or what are your recommendations for people that might have, siblings that are potentially one day be a caregiver too?
Yeah, it's a great question. I'm really glad you asked that. The sibling issues are something I'm also very passionate about. And I think for my family specifically, with my brother having the severe form, it was something that was necessary for my family for us all to be hands-on. My brother, as I mentioned, has a lot of behavioral challenges. So just from that, I kind of was already in the picture of just trying to make sure he's safe, my mom's safe. It's hard to talk about that safety issues are a thing with Hunter syndrome, especially the severe form. So that's kind of how I got introduced, was just going to the appointments to be there to make sure there was that support. And I'm really glad that I was there because as I've seen, um, there's so many challenges that come with aging, and my parents are getting older themselves, and we're starting to think about now what's going to happen when they age, who's going to be the main caregiver for my brother. And I'm really grateful that I was involved in the conversations when I was a kid. I think one of the things to mention though is it's really important to think about what information you are providing to siblings. So a lot of that needs to be age appropriate and specific. So when I was younger, like for example, my brother was diagnosed at 3, me going to the appointments with him at that age, I didn't get much information other than, your brother's sick and needs more help. And just that in itself was helpful for me just to know what's going on. We were in and out of the hospital so many times. So I got that understanding. And then as we got older, my parents gave me more and more information. And then doctors just saw me at every appointment. So they started giving me information too. So really tailoring the information based on the age, based on what you want the sibling to know is really important. And then I think what's the last thing I'll say is like, if a sibling wants to be involved, kind of just asking them how much information would they like. We often find that siblings are so mature and also just so curious to learn more. So just asking them, like, do you want to know more about this information, and then giving it to them. And then if they have questions, making them feel empowered to ask the doctors themselves, like, what are your questions? Like, what is MPS? What is a gene? And then just getting that involvement helps as they age because they're already involved. And we're finding that as parents age, siblings need to be involved. Yeah.